On today's World Insight, the UK retracts the controversial herd immunity strategy. Why have the UK and the EU taken different approaches to tackling the outbreak? And we speak to Zhang Wei Li, UFC Women's Strawweight Champion. She talks about fighting discrimination with her latest win in the ring.
The only way to win respect from opponents is using my fists.
And finally, getting down to business in the time of the coronavirus. How an organic farm outside Beijing managed to cope against all odds. Here is our host, Tian Wei.
Hello and welcome to World Insight, coming to you live on CGTN. I'm Tian Wei. We begin today's program in the UK, where pressure is mounting to adopt more stringent measures to face the growing COVID-19 crisis. The UK's decision to tell residents over 70 to self-isolate comes after backlash over its herd immunity proposal, a strategy relying on at least 60% of the population getting infected and becoming immune. So is it really reliable? Can it really protect people from coronavirus? We're going to get deeper into that debate, but first, this.
Another day and another change of tack in the UK's battle against coronavirus. This time, anyone over the age of 70 will be told to stay at home and self-isolate. For how long? The country's health minister was unable to say. When will it start? That too remains unclear. But Matt Hancock says the government will be able to force people to quarantine.
Well, we are going to take the powers to make sure that we can quarantine people if they are a risk to public health, yes. And that's important. I doubt that actually we will need to use it much because people are being very responsible. And people need to be responsible.
There's growing concern in the UK that the official response hasn't been strong enough. Schools haven't closed and there's no major lockdown in place. More than 200 scientists from some of the world's leading universities have written an open letter to the government calling for action to stop the spread of the virus. It said, by putting in place social distancing measures now, the growth can be slowed down dramatically and thousands of lives can be spared. One major concern here in the UK is that the Public Health Service might be unable to cope with the impending rise in cases. According to EU data, the UK has fewer hospital beds on average than most European countries, including Italy, France and Germany. The government says it's putting aside more than $6 billion in emergency funding for healthcare to cope with the virus. Its plans include taking over hotels and turning them into makeshift hospitals. The man leading the fight says every single person in the UK will be affected by COVID-19. But there is growing unease about the approach this country is taking.
And join us in London, we have Rosanna Pilling, Professor and Chair of Diagnostics Research and Director of the International Diagnostics Centre at the London School of Hygiene and Tropical Medicine. Professor Pilling, what a pleasure to see you. The debate about the herd immunity has been the biggest one, I guess, topic in the world. What do you make of that and the 200-person open letter against it?
Well, I think that the government strategy has been informed by good science and modeling of different interventions and their effectiveness. And so I think that given that we don't know all we need to know about the virus, but as far as what knowledge we have at the moment, I think the government is doing the right thing and not to create a lot of measures that cannot be sustained. A lot of the infections have gradually been introduced in the UK over, the last 2 months.
I see.
And so I think this is the best population-based strategy at the moment.
You think to have 300,000 to 1 million people infected and also possibly being killed could be a good strategy for the UK?
I don't think you should think of it that way. Unlike SARS, unlike what we saw with MERS-CoV, which are the two other coronaviruses that have caused epidemics around the world, this coronavirus has a very large iceberg of asymptomatic or mildly infected people at the bottom of the confirmed cases that we see. So it's inevitable that you cannot be testing everyone because that's a lot of wasted resources that you could have allocated towards shoring up hospital capacity for dealing with more severe cases, etc.
Yeah,
so the confirmed cases that every country sees is just at the very tip of the iceberg. Beneath that, there's a large population that is gradually acquiring immunity to this virus. And so by having herd immunity, then you have a larger distance between susceptible people that the virus could transmit.
I see.
And that is a sound basis for this.
We understand the basis for this, but people have been asking about questions from a very different angle, and I have to emphasize that angle. Is the UK ready and to announce, first of all, publicly, and then to do it, to have 300,000 to 1 million people lose their lives? Whose lives should they be? Should they be the elderly's life, or should they be the government officials, or should they be the medical workers, or should they be the most severely ill? Whose lives should they be? How is that choice likely to be made by the government?
I think we know from epidemics elsewhere that the most susceptible people and most severely affected people are the elderly, especially with underlying comorbid conditions. And so I think the government is doing all it can to make sure that they are safe, and so hence is strategy for anybody over the age of 70 to self-isolate.
It's your internal affairs, whatever you want to do with the cases in your country. Of course, you decide on your own. However, it does have an impact on the overall pandemic worldwide, because if virus develop and flourish inside the UK is going to be a black hole in terms of this global fight against this pandemic. In other words, UK could be very selfish by doing that, not to mention it would kill many lives also inside your country. So how is it likely to be explained? Another thing is, when you say the government is doing all it can, what do you mean by quote-unquote doing all it can? So far, there has been a lot of accusations against government not doing much, for example, about the large gatherings. And we all know social distancing, very crucial, and doesn't take much to do social distancing. I mean, well, what about the elderly? And we also understand that the beds of the hospitals are not as many as one would expect. But you see other countries, they are rushing to prepare the beds. One more bed, you can probably save one more life. But if efforts are not being made, how can you save lives? People can just say, okay, well, that's it. We can't fight it. Let's just let it be. WHO said you can't do that, Professor Pilling. No,
I think you have to understand that you know, in the case of coronaviruses, I mean, coronaviruses have been the cause of common colds for a long time. And we know that in most cases, people are either asymptomatic or have very mild
Professor
infection.
Pilling, if I can,
and so
I'm sure as
yes.
an expert, you would know better than I do. Coronaviruses comes in all different types, and this is called a novel
yes.
coronavirus. And this time, this virus is very different from earlier, even from SARS. We've been talking about that, hearing about that from WHO for 2 months. So when you say there's a comparison can be made between cold and flu and this one, it is just not true, Professor. I'm afraid you cannot use that comparison.
Well, I guess we don't know all is there to
No,
know
but at
about
least
this
we do
virus
know
yet.
something
But I
at
think
this
that
moment. If we know something, we better use
yes.
what we know already,
Yeah.
not to make a wrong comparison again. I'm sorry,
Yeah.
Professor.
Yeah. So I think that what we know in most countries, what's the most effective: hand washing, social distancing, self-isolation or quarantine of infected cases, confirmed cases. The UK is doing all of that.
Okay,
and
so Professor,
whether,
if I could just give you
yeah.
some examples of what other countries have been doing. Now you see what China has been doing over the past 2 months. I don't want to repeat it. If you see South Korea, which is much smaller a country than the UK, and also when it comes to economic power, similar somewhat. They've been testing 15,000 people a day from the very beginning, and they're struggling, and they are doing a great job. If you look at Singapore, also, of course, they have better medical facilities earlier, but they do also try with social distancing. If you look at also some of the other countries, in Germany, for example, ordered already 15,000 ECMO over the past 2 days by German government. If you look at Italy, they are struggling, but in the northern part of the country, the doctors are making every effort, and the government say, let's shut down the city, let's shut down the country, even though it is in the Italian way. So, Professor Pilling, when you are saying the government is doing everything it can in the UK, I don't want to make judgment, but by comparison, certainly everybody could have a judgment about the result.
Yes, and I think that you have to understand that for example, in South Korea, Singapore, I mean, in South Korea, they had a very acute phase where there's a burst of cases that arise from a church congregation. And so in that particular circumstance, then you should be doing very aggressive testing to know who's infected, who isn't, what is the true extent of the outbreak, so that you could know what to do. But in the case in the UK and certain other countries are different in that you had a gradual infiltration of the infection into the population through global travel, etc. And so it cannot be the same. I mean, the WHO clearly defines, the 4 C's, the circumstance where you have no cases, circumstances where you have only sporadic cases, and then when you have clusters of cases, and then when you have a generalized epidemic within the community. And so I think that each country has to decide based on their resources available, their healthcare infrastructure, and also how responsive is the public to these public health measures to decide what's the best scenario.
I certainly understand your argument, but Professor
Pilling,
it also has a lot to do with public advocacy. If you don't talk about it, you don't give people information, if you don't tell them how to protect themselves and their beloved ones, if you don't tell them whether there's resources out there for them to go to before their lives will be lost, of course they are not going to be aware of it. But, Professor, if I could once again to emphasize that question, what about the UK as a responsible country in terms of public health for the rest of the world? Now, everybody, it seems, at least according to their public policy, are trying to fight against this. But if UK is not, and let it circulate as if we are in 1918 for the Spanish flu, then things are going to get over expectation, because the virus could become ever more severe as a result of the UK not doing anything except, unlike the other countries. So, Professor Pilling, is the UK going to be a responsible player, or just like the others fight the pandemic and let whatever it is within our country?
I think the UK is a responsible player. But it's just that every country has to decide on what is the appropriate strategy given the situation in their country and the healthcare system. The UK has a very good healthcare system, and it's not going to really suffer unnecessarily, and they're already doing a lot to try and increase capacity to cope with the severe cases, so to prevent the deaths. And I take exception to your saying that the virus will become more severe. I think if you know, past history, if it's any indication, usually as the viruses go through different populations, they become more attenuated and is unlikely to become as severe as when it first hit the human population.
Once again,
so
this is a virus that we do not know, and we
yeah.
also have the earlier example of 1918 Spanish flu, which it got different circles, and every time it become ever more severe. I'm not an expert at you, but I did read a little bit. We're running out of time. Professor, last words.
So I think that the responsible thing is for the public to do all it can because of the large asymptomatic pool of infections in every community now around the world, because the virus has been circulating, whether we like it or not, through global travel and the connectivity between people. And so I think that's the most important thing right now. And the government should be really trying to prevent deaths by having the facility to be able to cope with severe cases and confirm them as quickly as possible, which is what the UK government is doing.
Rosanna Pilling, a professor with the Diagnostic Center at the London School of Hygiene and Tropical Medicine. Thank you so much, Professor. Our debate is for people to have their own judgment, and we do not want to have any decision made for any country by us or by anybody else. Thank you so much, Professor, joining us.
Okay.
Appreciate it.
Thank you.